Yeah, so we'll start with the first speaker. Is Dr. Matthew KOSHY. He'll be talking on a comparative study of corneal endothelial cell count in diabetics and non-diabetics.
Good afternoon. Today I am going to present a paper on the topic a comparative study of corneal endothelial cell count in diabetics and non-diabetics in a tertiary care hospital in North Kerala. Coming to the introduction and rationale of the study, diabetes may cause corneal endothelial morphological alterations in average cell size, coefficient of variation, corneal endothelial cell density, and hexagonality. Keratopathy is a significant consequence of diabetes mellitus. Therefore, changes in corneal findings are increased along with progression of diabetic retinopathy. Diabetes mellitus can lead to ocular problems that include diabetic retinopathy, corneal endothelial cell change, superficial punctate keratitis, recurrent corneal erosion, and persistent epithelial abnormalities. Aim is to study corneal endothelial cell count in type 2 diabetes mellitus patient and non-diabetic individuals. Objective is to assess morphological changes in corneal endothelium in type 2 diabetes mellitus patients. Methodology: study design is a hospital-based comparative cross-sectional study. Study setting is among already diagnosed type 2 DM patients and non-diabetic individuals attending ophthalmology OPD of a tertiary care hospital in North Kerala. Study duration is 1 year after obtaining ethical clearance. Sampling was done by convenient sampling. Sample size was 92 for each group, which was obtained from a previous study by Ahmad et al. Inclusion criteria for cases are patients between ages of 18 and 70 years with already diagnosed type 2 diabetes mellitus, and inclusion criteria for controls are healthy individuals without type 2 diabetes mellitus between age of 18 and 17 years coming for health checkup are selected. Exclusion criteria are those wearing contact lens user, history of dry eye disease, patient who underwent any procedure like laser, intravitreal injection or previous ocular surgeries, anterior segment disease or any corneal disease, type 1 diabetes, history of glaucoma, ocular trauma history, and continuous use of topical medication for any ocular disease. Method of data collection: it was collected from both eyes of the patient and instruments of the study. This is an image of the corneal endothelial cell count by which a non-contact specular microscopy is used, and along with this we used a slit lamp biomicroscopy and indirect ophthalmoscopy with 20 diopter lens, and a comprehensive ocular examination was performed on all subjects. The corneal endothelial parameters are recorded, and coming to the results. There are 27% had diabetes within the duration of 5 to 9 years, and for the less than 5 years it is about 46%, and 68 had no systemic complications of diabetes, 13 had history of coronary artery disease, and 7 had chronic kidney disease, and 4 had history of diabetic foot. On comparing corneal morphological parameters in diabetic group by using Pearson correlation, it was observed that corneal endothelial cell density is having positive correlation with hexagonality and negative correlation with average cell size and coefficient of variation, which is seen in that table. And it also shows that the mean corneal endothelial cell density decreased and the mean average cell size increased with increase in duration of diabetes and severity of diabetic retinopathy. These observations were considered statistically significant as p-value obtained is less than 0.05, and the best corrected visual acuity, corneal endothelial cell density, average cell size, coefficient of variation, and hexagonality were assessed, and results showed that the mean corneal endothelial cell density and mean hexagonality in the diabetic group is decreased, and the mean average cell size and mean coefficient of variation in the diabetic group is increased when compared to the non-diabetic group. This signifies that there is pleomorphism and polymegathism in the diabetic group. Coming to the discussion and conclusion, in diabetic patients there is decreased corneal endothelial cell density, increased average cell size, increased coefficient of variation, that is polymegathism, and decreased hexagonality, that is pleomorphism, which is not associated with age-matched non-diabetic individuals. The results of this investigation corroborate previous notions of reduced endothelial cell density among participants with type 2 diabetes mellitus compared to non-diabetic persons. These changes correlate with diabetic age and retinopathy severity, and presence of microscopic changes in diabetic corneas might cause more chances of corneal endothelial decompensation during cataract surgery, which shows importance of preoperative corneal endothelial assessment, and judicious use of ocular viscoelastic devices at the time of cataract surgery in the diabetic patients. Therefore, people should be aware of various risk factors associated with development of diabetic retinopathy, and this signifies importance of early ophthalmological screening programs and patient education to diabetic patients to avoid preventable blindness caused due to diabetes associated retinopathy and keratopathy. These are my references. Thank you.
Any correlation was there with the HbA1c and all these things?
Yes, HbA1c also, as the Sugars values uncontrolled, the HbA1c values are increased, and it shows that the corneal endothelial cell density is also decreased. It was also compared.
What's your advice now? Because you have compared now.
So we have to do a regular screening about the diabetic retinopathy status and also correlate with
you have studied about hexagonal, that mainly corneal
endothelial cell density.
By studying endothelial density, what are you going to achieve now?
So if you are planning any cataract surgery, we can take adequate precautions that the corneal endothelium is protected. So further damage and chance of further decompensation are reduced.
Thank you.
Thank you, sir.